Neuro-ophthalmology is everything to do with the eye and vision that's not inherent to the eyeball itself. So problems behind the eye, in the eye socket, moreover problems of the brain, problems in the nervous system, or systemic diseases that affect eyes and vision. And surgical ophthalmology, surgical neuro-ophthalmology, is the application of surgical techniques to correct some of those problems. 40% of our brain is involved with vision, not only the direct transmission of the visual signal from the eye to the brain, but then the processing of that visual information beyond the occipital cortex into the higher cortical regions so that we can logically make deductions about what we see in our environment and act on those deductions. It's not necessarily that surprising that we have the human being, which is an exceptional visual being, and where vision is so important in our day-to-day activity. In terms of neuro-ophthalmology, we're viewed as the problem solvers, and the surgical neuro-ophthalmologists are also viewed as having a role in fixing the problems. So when someone has a disturbance of vision, it's typical for them to seek evaluation from an optometrist or ophthalmologist. And when the answer to the source of the double vision or the reduction in vision is not obvious in the examination of the eye itself, then the next step would be for the optometrist or ophthalmologist to refer that patient to the neuro-ophthalmologist. So my referrals are chiefly patients who have a disturbance of vision, either double vision or reduced vision or some subjective alteration of vision that doesn't have an obvious cause in the examination of the eye itself. Careful clinical examination in and of itself provides some clues as to whether or not the double vision is caused by a eye muscle imbalance or a cranial nerve deficit or a cerebellar disorder or a brainstem disorder. One of the most satisfying things about what we do is that sometimes we see the benefit in the recovery room. And it's very dramatic when someone goes into a surgery with significant problems with their vision. But indeed, some of our patients in the recovery room will tearfully say, "I can see again." I can't think of anything more satisfying.